Hello students, so today we start our most important topic, that is infection. So let's start. So how we protect from infection? There are 4 precautions. First one is standard. Second one is contact. Third one is droplet. And fourth one is airborne precautions. So let's start one by one. First one is standard precautions. First one is standard. So in standard, these are the basic precautions. So you have to use for each and every client. Okay. So in infection, first thing is hand washing is the number one infection prevention. So you have to prevent infection from, the number one thing is hand washing. You have to do hand washing every time. Okay. So in standard, this is the basic precautions used for each and every client. Next one is contact. So this is important. So contact precautions. So in contact precautions, all problem start with either enteric or fecal oral disease or root, right? Contact precautions, these are the problem that start with either enteric or fecal oral disease. Okay, so in contact precautions there are some example, so you have to write. First one is C. difficile, Clostridium difficile, Clostridium. Next is diarrhea. Next one is cholera. Next one is dysentery, also called a bloody diarrhea. Next one, these all are under contact precautions: rotavirus, hepatitis A, and Salmonella typhi. So in contact precautions, there are many examples. So first one is C. difficile, that is Clostridium difficile. Next one, diarrhea. Third one is cholera. Next is dysentery. This is also called a bloody diarrhea. Then rotavirus. Then hepatitis A, and Salmonella typhi. So there are other examples. So you have to write. Next one is MRSA, that is methicillin resistant streptococcus aureus. MRSA. Contact precautions. You have to use contact precautions in MRSA. Next, all strep and staph infection. Next, scabies. Next one is HSV, that is herpes simplex virus. So other example, that is MRSA, methicillin resistant streptococcus aureus. Next, all strep and staph infections, scabies, and HSV, that is herpes simplex virus. In HSV, herpes simplex virus, both oral and genital. Okay, so there are some more example. That is at RSV. What is RSV? That is respiratory syncytial virus. You have to remember RSV contain both contact plus droplet precautions. You have to use contact as well as droplet precautions in RSV. So next one is herpes zoster, also known as chicken pox, right? So in herpes zoster, you have to use contact plus airborne precautions. In contact precautions, you have to use some like gloves, gown, hand washing. So next, what are the component or what we use in the contact precautions? So here is list. First one is you have to use gloves, gown, hand washing is number one. So here is hand washing. Next is private room, and cohorting is allowed. Cohorting means same room, right? Allowed with same disease, person having a same disease, so you have to cohorting with that person in contact precautions. So here are some precautions. So first one, in RSV. What is RSV? RSV is a respiratory syncytial virus. Okay. In which majorly transmission by droplet, but precautions are contact. Got it? In RSV, you have two precautions by using contact precautions, but RSV transmission, they can transmit by droplet. Okay. So in RSV, majorly in up to 2 year of child, up to 2 year of child, the droplets are suspended around the environment, mainly where stuffed toys, bed sheets, and clothes. So we have to use contact precautions in RSV, that is respiratory syncytial virus. Okay. So here is in RSV, more the baby is small in age, so more prone to infection. So you have to use contact precautions in RSV. So next there are some few points you have to remember for the NCLEX exam. C. difficile and rota virus are only prevented with hand washing with soap and water. So you have to use soap and water in C. difficile as well as rotavirus. So in C. difficile and rotavirus, never use alcohol waste sanitizer for these patients. So you never use alcohol waste sanitizer for these patients, that is C. difficile and rotavirus patients. So you have to use soap and water. So here are some some points. So next, so one thing in contact precautions, you have also a dedicated personal equipment for the patient. So that's it for the contact precautions. Next we have droplet precautions. So start droplet precaution. So today's topic is most important for the exam, so you have to learn these notes, easy notes. So in droplet precautions, how to remember, there is one mnemonic. So first one is pimp, PIMP. Okay, P stand for pneumonia, I for influenza that causes epiglottis. Influenza cause epiglottis, and M for meningitis, and P for pertussis, also called boofing cough. So in droplet precautions, there are some special mnemonic. First one is PIMP. P stand for pneumonia, I for influenza, M for meningitis, and P for pertussis. This is the easy way to remember. Okay, so next is Spider Man. This is also under in a droplet precautions. So you have to remember S stand for scarlet fever. P stand for pertussis pneumonia. Parvovirus and para influenza. Next, I stand for influenza. Next, D stand for diphtheria. D stand for diphtheria. E stand for epiglottitis, sorry. So here S stand for scarlet fever, P stand for pertussis, pneumonia and parvovirus and parainfluenza. I stand for influenza, D stand for diphtheria, and E stand for epiglottitis. Next, R stand for, next one is R. Okay, R stand for rubella and rhinovirus. M stand for mumps and meningitis also. Special Neisseria, that is bacterial meningitis, Neisseria meningitis. Okay. Next, AN, both stand adenovirus. So in adenovirus, you have to use contact plus droplet. Okay. So next one is what are the PPE that we use in droplet precautions, personal protective equipment. So there are some points. You have to maintain distance about or up to 3 feet. Okay. While sneezing and coughing, patients are suspended up to 3 feet, maintain distance and PPE. Okay. So here is first point is distance up to 3 feet. Private room. Private room plus door closed. Okay. In droplet precautions, there is private room and door closed. Strict hand washing. Hand washing is the first one. So you have to do strict hand washing, and important is surgical mask for whom? For nurse, for all the time. What kind of mask? You have to use surgical mask. In droplet precautions, you have to use surgical mask. Next point is in droplet precautions, next point is while transporting a patient from one place to another, so patient use while transporting as surgical mask. So surgical mask for patient only while transporting. Okay, in droplet precautions, surgical mask for patient only while transporting. Next, PP is face shield. Gloves, but there is no need of gown. So first one is distance up to 3 feet. Okay, dedicated and disposable equipment, the same, and strict hand washing, private room plus door closed. Okay, surgical mask for nurse for the all time, and surgical mask for patient only transporting. Okay, next is face shield and gloves. So that's it for the droplet precautions. Next precaution, that is that one is air airborne precautions. Airborne precautions. Okay. In airborne precaution, in airborne precaution, there is one mnemonic, that is MTV. You have to use MTV in airborne precautions. M stand for measles, T stand for tuberculosis, and B stand for varicella, that is chickenpox and shingles. And also here is SARS, severe acute respiratory syndrome. Okay, that is COVID. So in airborne precautions, you have to remember MTV, measles, tuberculosis. M stand for measles, T for tuberculosis, B stand for varicella. Okay, and here one is another one is SARS, that is severe acute respiratory syndrome. Okay, it is the easy way to remember. Okay, in droplet precautions, you have to remember PIMP and spider man. But in airborne precautions, you have to remember MTV plus SARS, severe acute respiratory syndrome, MTV. Most important is MTV, measles, TB, varicella. In airborne precautions, droplet. In droplet, there is P stand for pneumonia, I for influenza, M for meningitis, P for pertussis, S for scarlet fever, P for pertussis, pneumonia, parvovirus, parainfluenza, I for influenza, D for diphtheria, E for epiglottitis, and R for rubella and rhinovirus, M for mumps and meningitis. Meningitis have most important bacteria, Neisseria meningitis, and AN stand for adenovirus. Got it? So I will continue with the airborne precaution. Okay, in airborne precaution, maintain distance up to 6 feet. In droplet, we have to maintain 3 feet, but in airborne precautions, you have to maintain 6 feet distance. So in airborne precaution, there is private room plus negative air pressure or negative isolation. So what is mean why negative air pressure? So here negative air pressure mean door plus window all these are closed in airborne precautions. You have to close door as well as window. Okay, so in next, here are some few points in airborne precautions regarding PP. So first one is you have to use N95 mask, respirator mask. In airborne precautions, you have to use N95 mask for every nurses and staff. Every time you have to use N95 mask. Okay, and for client you have to use surgical mask for client while ambulating. For client you have to use surgical mask while ambulating. Okay, so gloves, you have to use gloves, face shield, and dedicated plus disposable equipment is also is there. And next, hand washing is must, so hand washing is also must. So that's it. So here is one thing is more important, that is what is donning and what is doffing. What is donning? Okay, what is donning? PPE. Okay, and what is doffing? P, personal protective equipment. But is donning and but is doffing? It is, this is the also important for the exam. So how to wear and how to remove the personal protective equipment. So first one is donning. PPE. Donning means down to up. How we all remember? Down to up. So first one you have to do hand washing, then you have to wear gown, then mask, then face shield, then goggles, then gloves. When you wear goggles, you have to do hand washing. How to do donning? First one is gown. Next one mask, then face shield, then goggles, then gloves. Okay, got it? How to wear a personal protective equipment. Donning means down to up, so you have to follow. First of all you have to do hand washing, then you have to wear gown, then mask, then face shield, then again you have to wear goggle, then again you have to do hand washing, then put gloves. This is the steps for donning. So friends, rest of the topic I will continue with the next video. So thank you.